All right, I guess we can start. Am I audible to everyone? Wonderful. Okay. Good evening, everyone. Welcome to this webinar on the launch of Intersex Asia's research publications. It's great to see a good turnout on a Friday evening. Um, I mean, I shouldn't really be that surprised. It's a special day, and we are celebrating Intersex Awareness Day tomorrow. So we're doing this webinar on the eve of Intersex Awareness Day. Uh, Before I move on, I request everyone who is interested in the Bahasa, English to Bahasa interpretation to switch to the relevant channel. There's already a message in the chat with specific instruction on how to go about the same. And please feel free to reach out to Intersex Asia team if you're having any trouble with regard to interpretation. All right. So welcome again. Let me first start by introducing myself. My name is Prashant Singh. I work at Intersex Asia as the Research and UN Advocacy Officer. In my role, I'm in charge of coordinating our research projects and supporting our member organizations in engaging with UN mechanisms. Um, I'm really happy to welcome you all to this webinar where we are launching the 8 country reports from the Southeast Asia region. For those of you who are joining Intersex Asia's event for the first time, let me briefly introduce the organization as well. So we are a registered regional network based in Taiwan. Um, we are a network organization and we have got member organizations present across the Asian region. In terms of our scope of work, we focus on awareness raising, community building, capacity building, um, creating knowledge resources through our research work. Have been We started in 2018, formally registered in 2020, and since then we have continuously expanded our scope of work. Research initiative was one of them, and today we are celebrating, the completion of one major milestone of our research initiative, which was started in 2021. So it gives me great pleasure to welcome you all for this webinar. Today, basically, I'll be moderating a panel discussion with a stellar group of activists and authors who have contributed to our report. Please join me in welcoming Jeff Kagandahan from Philippines, Nada from Thailand, Nicole Fong from Malaysia, Edith and Tata from Indonesia. Uh, these are the speakers for today. Let me briefly introduce each one of them. Um, Jeff is the president of Intersex Philippines and co-chair of Intersex Asia. Um, Jeff is one of the senior most activists within the region. They started with their own journey in activism while winning their right to change the name and gender marker in identity documents from the Philippines Supreme Court in 2008. Later on, co-founded Intersex Philippines, co-founded Intersex Asia, and currently is leading the advocacy efforts with regard to the passage of Kagandahan Bill, which will simplify the process of changing gender markers for intersex people within Philippines. So all our best wishes to you, Jeff, for all these advocacy efforts that you are undertaking. Now let me come to Nada. Nada is well-known activist from Thailand, lecturer at Mapei Luang University School of Law based in Chiang Rai. Nada co-founded Intersex Thailand and has been associated with several prominent human rights organizations within the country. Somebody who is also an author of the country report from Thailand. Nada also drafted the first comprehensive draft legislation on the protection of intersex rights in Thailand. It has also been translated into English. You all are welcome to read it from our website. So again, our second speaker is also very passionate about legislative reforms. We are most than welcome to check out the work that they do. Now let me come to Nicole. Nicole is a feminist researcher, human rights defender, and writer working on LGBTQ plus rights, statelessness, refugee and migrant rights. Nicole is also one of the authors, and Nicole prepared the report on Malaysia. Thank you so much for all your efforts, Nicole. Nicole is very much passionate about feminist participatory action research, which uses primary data. They are committed to evidence-based intersectional feminist informed policy making. It has been a great pleasure collaborating with you, Nicole, while working on the Malaysia country report. Thank you so much for joining. Um, then we have Tata from Indonesia. Tata is an intersex activist based in Indonesia. They started Collective Intersex, which is an intersex-led organization of Indonesia. And they've been working on intersex issues since 2016, raising awareness, engaging with various stakeholders, including organizations, universities, and all types of stakeholders, primarily focusing on raising awareness. Welcome again, Tata. Then allow me to introduce Edith. Edith is a counselor, community worker, and writer. Edith is a co-founder and is on the supervisory board of a queer feminist organization and another queer member-based cooperation in Thailand. Oh, sorry, in Indonesia. Edith received their MA in Gender, Sexuality, and Body from the University of Leeds in 2017 and is currently undertaking their first year diploma in dance movement therapy. Since 2020, Edith has been focusing their work on self and collective care and has continued to deepen their knowledge and practices on healing justice, embodiment approach, decolonizing therapy, and mental health. In 2023, Edith received Radical Love Fund Fellowship from Mama Cash to support their current work. I should also mention Edith is one of the authors of the country report on Indonesia. A very warm welcome to all of you. Thank you for joining us as panelists for this discussion. Now, with the introductions, I would like to move on to the next part about our session. Basically, let me just give a brief background of what we are about to do. So I will first of all invite Heike Cho, Intersex Asia's Executive Director, for opening remarks. Thereafter, I'll briefly present Intersex Asia's research framework, which guided the entire work. Thereafter, we'll have the panel discussion for about an hour, and hopefully we will have some time left for question and answers. So with this roadmap out of the way, let me welcome Heike Cho, Executive Director of Intersex Asia, pioneer of Asian Intersex Movement, founder of Intersex Asia, as well as OI Chinese, to deliver the opening remarks. Heike, over to you.
Thank you, Prashant. Thanks for all the panelists and researcher and the public participants to join today's webinar and the launch of the 12 research, the 8 research of the Southeast Asia. Intersex Asia started in 2018, and we determined to create evidence-based research for our movement here in Asia. So this is the one of the project that we did for under this goal. It is not easy because in Asia we don't have any similar research of this kind. I think this is the very first time that we did research about protection of intersex rights in Asia region. So this is the first track. Thanks for all the community people, the support, so we can have this result, and we will continue to make effort in terms of research to creating the evidence-based database for our movement in Asia, so people can use it to mobilize our policy change in Asia region. Thanks for your concern about this issue. I really appreciate it and welcome to share your point of view and your feedback and with us. We are happy to learn and listen from every one of you. Thank you.
Thank you, Hiker. I was about to discuss the Intersex Asia's research framework, and you've made my job easier. So, like I said earlier, I'll be briefly discussing the manner in which we approach this particular initiative. So, for some of you who have been following the Asian Intersex movement, you may have come across the Asian Intersex Statement, which is the most important document when it comes to the manner in which the organization has been structured, the manner in which the Asian Intersex movement has pursued its advocacy work. So our research framework is also premised on the Asian Intersex Statement. The first version of the statement was adopted in 2018. The second one was adopted in 2019, and then we made a major revision in 2022. And the final version of the Asian Intersex Statement was released in 2023. So basically, the statement is a collection of demands of the intersex community with regard to various thematic areas of their life. So it is a very comprehensive document, and I encourage everyone who wants to learn about the Asian intersex community to go through the statement. It is available in English and also 15 plus Asian languages. So you're welcome to check out the statement on our website and also look at the various translated material which is available. So in this particular statement, basically, the demands are structured into various thematic sections, ranging from protection of intersex people's right to bodily integrity, protection from discrimination in all areas, access to health, education, public services, protection from hate crimes, the manner in which gender marker registration is done at birth, legal gender recognition, access to justice, data collection, and lastly, inclusion in emergency policy response. Mind you, the last bit, that is the inclusion in emergency policy response, is something that was added after the pandemic, given the kind of challenges that intersex community faced, during the COVID pandemic. So just like the statement, as you would find, all the country reports are also structured in a similar manner. We initially planned that we would conduct the research in two stages. The first stage would be uh, primarily a literature review in which we would engage a national level researcher because they are more familiar with the national level context, and conduct a proper review of the laws and policies which are relevant to intersex people in that country, and also look at the academic literature which is available on the subject. Thereafter, we thought during the second stage, we would also conduct a consultation exercise in which we would try and um, engage with the community members and see how the first report from the first stage actually corresponds with their life. Um, we would have really liked to do this community consultation stage, in all the all the 8 countries. However, we were not able to do it, we were not able to conduct the second stage in any other country except for Philippines. So Intersex Philippines did organize a community consultation event in last year, where a very good report has actually come out from the second stage. However, all the other country reports only are limited to the first stage. That is a overview. However, we don't want to stop here. This is a very preliminary exercise that we did because there was hardly any literature available when it comes to intersex rights from a human rights perspective, about intersex people. Mostly the literature available is medical in nature, and that's why we wanted to create something firsthand. We hope that all these reports are, utilized by all the relevant stakeholders with regard to advocacy on intersex issues. But this is just the first step that we have taken, and there's a lot more to be followed. With this brief background to the research framework, let me now jump to the part which everyone must be waiting for. Let's start the panel discussion, and maybe I'll start the first question with and direct it to you, Jeff. Can you hear us? Wonderful. So, Jeff, given your experience in intersex activism, I was wondering what would be your perspective on the impact of research on advancing intersex rights and creating an independent narrative on this issue?
Hello. Yeah. I think as an intersex activist, I see research as a pivotal force in advancing intersex rights, shaping an independent narrative around intersex experiences. I think research increase visibility and awareness, providing much needed evidence to challenge misconception and stereotypes that persist in our society. The visibility is very essential, not only for educating public, but also for informing policymakers about the unique challenges that intersex individual face, such as discrimination, lack of access to health, and the consequences of non-consensual medical intervention to intersex infants and children. Involving the intersex community in the research process is very critical. When research is conducted in collaboration with intersex individuals, it ensures that our voices are heard and are heard and represented. Okay, so this participatory approach fosters a sense of ownership and empowerment, allowing us to articulate our needs and desire rather than define by external narratives. So it helps us to dismantle the often harmful and reductive medical frameworks that have historically pathologized intersex variations. And also challenging the prevailing pathologizing narrative surrounding intersex body is also crucial. Many existing medical frameworks treat intersex variation as conditions to be fixed rather than as a natural variation of human diversity. Okay, research, I think, emphasize on the normalcy and validity of intersex variation that can shape societal perception and encouraging acceptance and celebration rather than stigmatization. Thank you, Parshal.
Thanks a lot, Jeff. You made a very important point, the importance of actually ensuring that the community is very much involved in the framing of the research as well, and then very much involved in the process of conducting the research. And that's something which we have really followed at Intersex Asia while preparing the research framework and then also engaging with the community at every step of the process. Building on from what Jeff has said, maybe now I'll turn to you, Nada. I wanted to ask if you can share about the context of intersex activism in Thailand these days, and also if you have noticed any impact about the conflation between transgender and intersex rights, because that's something which is very much common across the region. I wonder if it's the same in Thailand.
Thank you, Intersex Asia, for having me, and I'm honored to be a part of the initiative and significant movement for our Intersex Asia movement to include Thailand's context in the overall research. Absolutely, like in terms of conflations, we cannot deny that it's happening like centuries and centuries turn back to the ancient time where the word Kathoy, like which we are adopted this term from Cambodian, language, which in fact, according to the Royal Institutions of Dictionary in Thailand, is defined Kathoy as a person who have both male and female sexual organs, and it also means a person whose mind and behavior are opposite in their sex. So it is also used to describe about the like sterile fruits or plants, and also in medical terms, refer to person has both female and male organ in the same body. So that's why these historical definitions is significantly create conflations because people get confused, especially in the public perceptions, getting confused about probably they are the same group, which is totally different. In our report, we have some challenges to distinguish because In the same time, we would like to also like be proud of ourselves to be called as Katari for those intersex individuals who want to feel, like they are the Katari terms. It's exactly fit to their like reflect their sex, their innate sex characteristics. At the same time, we found that so many transgender people also proud to also use the word Katari. That's why it's the continuity of like conflations keep on going and its impact in terms of, for example, the misconceptions in the healthcare setting, like medical practice often still conflate intersex and trans health needs. For example, like limited awareness of healthcare providers for specific intersex needs has been left out, like mostly focusing on trans health in terms of, for example, hormone replacement therapy, which is probably required in different level of intersex individuals, which is intersex individual also some of intersex individuals also need, to access to hormone treatment, but based on, like a kind of like tailor-made specifically for intersex individuals, which is there is no information available at all about how that the physician or the expert in the hormonal treatment could provide for intersex individual in Thailand. And in terms of legal challenges also, because even though in Thai administrative law, we will recognize some status of intersex can legally obtain their legal documents reflecting their gender identity is still the regulation also force them to undergo sex reassignment and must be diagnostic as true hermaphrodite, which is the old term, and still somehow create some kind of like negative impact and stigmatizations toward intersex individuals who want to, reclaim their rights for legal gender recognitions. So the impact of conflation also delay developing of specific healthcare protocols. Especially is also challenged with intersex children a lot because the forced are for intersex children to undergo and non essentials are medical intervention still, like the practice still ongoing happening in Thailand. So that's why we would like to distinguish when we draft the legal gender recognition law, and we saw the outstanding role model from Maltese identities and securities protection law. We took it and we developed to fit in the context of Thailand, especially in Thai law systems. So this is how we've been struggling, and in the same time, the draft law is now on the process to be submitted in the in the parliament. So as Thailand try hard to promote themselves to be the heaven of LGBTIQ and plus our community, and we are welcome for everyone to enjoy their freedom here. Thai government is now pursued to be the host organization for the World Pride 2030. I think it's a good significant moment for us to say like especially to ensure that our visibility is there. I is not mean invisible, I is mean intersex. So that's why we really try hard to focus on that. So this is a part of our research to present it to you all today. Thank you.
There's a lot to unpack there from what Nada said. And I guess one of the most significant impact of the conflation between trans and intersex actually has on the access to health services, I think, which is perhaps one of the most critical needs for the community. And also very good to know about the progress which is being made when it comes to the draft law. I hope that now that the government is getting a lot of credit for, making all the progress on LGBTQI rights in general, I guess some specific progress is very much needed on intersex rights. So yeah, all the best wishes to you, Ananda, and Intersex Thailand for continuing this work. Maybe now I can move to Nicole. Nicole, you've worked with us on the country report from, on Malaysia. And I wanted to know, given the report's finding that there is a serious research gap, and now that this particular report has been approached, in a participatory manner, putting the community at the center, can you share a little bit about your reflections on the importance of engaging with activists in the development of such kind of a research, report, and also how it affects on the advocacy part of things? Because it is generally, we should advocate that if there is a research being done on a community, then it should also involve the community. So how does it change the influence of that particular report on the advocacy work?
Hello, everyone. I hope you can hear me. Thank you so much again for having me. Yeah, no, I think it's a good question, but I think to sort of answer the question, I need to kind of go into a little bit about the findings. Some of the findings that I laid out very early on in the report, is that because when I guess your question asked about intersex human rights defenders, and I think unfortunately the state of it, intersex rights advocacy here in Malaysia, is that there are no intersex-led organizations or any advocacy efforts on intersex rights. And even amongst the LGBTQ groups and civil society that I'm also part of, we are very limited in our scope. And yeah, there's just very little information, resources, and stories also about intersex persons in the context of Malaysia. And yeah, it definitely needs to change. And then, it's like a very terrible cycle that even in the LGBTQI community that, well, minus the I in this context, that intersex persons are invisibilized even within the community. So then it just, yeah, what I said about the cycle is just like a low awareness. So you don't know about this group of people, and then you just continue existing, and then they are so isolated. But before I get to the isolation part, I think I just also want to touch upon about the point about how even the term intersex here in Malaysia is not really used. Like what Nada said, a lot of the outdated terms like hermaphrodite is more commonly used, or the very medical and religious terms like hunsa, I'm sure maybe potentially used in Indonesia too, is still used. So, and there's also like other colloquial terms that are used depending on the languages that the people that they speak. So it's just even trying to get like what do we mean when we say like intersex human rights defenders, and what do we mean? I don't think there's no intersex community here in Malaysia because everyone is so isolated and invisibilized, and like they don't. I think based on the few the small, very very small sample size people that I spoke to, they don't know very few of them know of other intersex persons. So they don't know each other. And they also, most of them, they're not connected with the LGBTQ community. So they don't know any of this. They're not in that space. They're still in survival mode. And I think just combined with all the things that, we said, the discrimination they face in education, healthcare, employment, it's just a very bleak experience for intersex persons in Malaysia. So having said that, there's a context. So I think I just wanted to explain all this because, yes, we're not even at the stage where we have intersex human rights defenders, or whether it's led by intersex people or non-intersex people, like there's just none. And I think we need to work towards getting to that space where we have more intersex human rights defenders. And that's something that I feel like there's going to be a lot more capacity building needed for intersex rights in the LGBT movement here in Malaysia. And there's also there's a kind of like a collective need to sort of move towards wanting to be more inclusive of intersex people within our activism and our movement itself, which there isn't. And I'm calling myself out as well. I'm not higher or better than everyone else in the movement, but yes. I hope that answered your question. Yeah.
Well, certainly. I mean, you have pointed out the challenges which are there in Malaysia right now. And this is something that Intersex Asia is very much, conscious of. Like I mentioned earlier, it's very much part of our scope of work to support the community organizing work. And I mean, we've been doing that since our, establishment, supporting any kind of community meetings. And yes, Malaysia is certainly one country where we need to do perhaps more and help the intersex community to get more organized. And I certainly take your point with regard to the issues with regard to terminology. Yes, pathologized terms are still being used, medicalized terms are still being used in many contexts, even in countries where intersex rights are getting recognized. These terms continue to be used, which create a an environment of stigma, a negative environment for intersex people generally, but also it has major implications with regard to all the other rights that they would like to exercise. But Nicole, if I can ask you one more follow-up about Malaysia's situation, and because generally the situation of human rights and LGBTQI rights in Malaysia is also challenging. How do you see the potential of engaging further on intersex rights in particular? Because in many countries where the majority of the population follows Islam, there has been some progress which has been noted on intersex rights, whereas there have been challenges with regard to LGBT rights. But when it comes to intersex rights, there is some window. So just wanted to probe you a little further on this particular point. How do you see the situation in Malaysia regarding intersex rights in future?
No, that's also a good question. I also forgot that that was one of the things that came out in the report. No, there is actually definitely progress within intersex rights, I guess, advocacy advocacy in terms of, especially in terms of changing your gender markers. Changing your gender markers or even your name. I did document cases but mostly through the medical practitioners who were able to change, who had cases where they were able to change the names and gender markers of some mostly Muslim cases, and that's because I guess in their view or in their mind, there's nothing wrong with them. They needed to, in their minds, they need to change either some medical or hormonal aspects for them to fit the gender binary. But that is accepted within Islam in the context of Malaysia. And when I speak to them, when I was speaking to these medical practitioners who were working in public hospitals, they were saying, yes, like we at the Ministry of Health and we take a quite a positive approach towards it, intersex people. And we recognize that yes, they may need to change their name, they need to change their gender marker but only in the context of so that they can live their life according to the gender binary that they are more closely assigned to or want to be in. But then I did encounter sort of like the dichotomy or the strong need to be like, okay, intersex people are intersex people, but they are different from transgender people, and that transgender people are sort of they shouldn't be conflated together. Transgender people are the one who want to, again, in quotation marks, simply change their names and simply change their sort of gender identity. So yeah, there's definitely the pitting of these two groups against each other in Malaysia. So it's kind of hard to, I guess, figure out how to move forward, because then you might have cases where I guess I don't know, they become more critical of intersex people wanting to change their gender markers because they sort of suspect, oh, maybe you're just transgender. And I think there is also that conflation within intersex people themselves. Maybe I'm not intersex, maybe I'm just actually trans. But it's very kind of convoluted, and yes.
Certainly, that challenge certainly exists. Even though you didn't really end on a very positive note, but I did get a lot of I did sense like a little bit of opportunity of making some inroads into, in Malaysia with regard to intersex rights. And hopefully, we'll get to collaborate further on this particular topic in future. Um, so now from Malaysia, let's move on to Indonesia, and we have two individuals from Indonesia. One is an activist, and one is an activist as well as a researcher. So maybe I'll first ask you, Tata. You are a co-founder of intersex-led organization, and for a long time, you have been focusing on raising awareness. I wanted to learn a little bit about how do you feel about these kind of research reports and how they contribute to awareness raising work, because that's one of the primary reasons why we started this initiative.
Oke, terima kasih. Sebelumnya maaf, aku pakai dua device karena yang satu kameranya rusak. Gitu. Ya, terkait dengan penelitian ini sebenarnya sangat membantu karena sebelum penelitian ini launching di hari ini, aku sudah dapat beberapa bulan lalu dan sudah aku pelajari dan secara langsung juga aku mulai mensosialisasikan hasil penelitian ini karena kebetulan bulan lalu juga aku diundang ke salah satu universitas Islam di Indonesia yang biasanya mereka menolak, tapi ini mereka menerima, bahkan memberikan kami satu ruangan yang bisa dipakai untuk kantor kolektif intersex. Gitu. Hanya saja oleh kami dari kolektif intersex kami tolak karena kami tidak mau, kami belum menindaklanjuti lebih jauh apa tujuan ini memang pure memberikan kepada kami atau ada niat lain di balik itu semua, gitu. Nah, selain itu juga penelitian ini sepertinya akan banyak diadopsi oleh peneliti-peneliti yang bergerak di isu keragaman gender dan seksualitas di Indonesia, karena per tahun ini saja dalam kurun waktu kurang dari 6 bulan sudah ada ya sekitar 3 lebih peneliti Indonesia ya yang meminta hasil penelitian kondisi intersex di Indonesia, dan mungkin saya akan mengarahkan atau memberikan hasil penelitian ini ke mereka, gitu. Karena aku lihat juga hasil penelitian ini ya betul adanya seperti yang terjadi di Indonesia, dan mungkin kenyataannya hampir sama juga dengan di Malaysia maupun Thailand. Kami tidak punya regulasi yang spesifik untuk orang-orang intersex, dan anak-anak intersex hingga saat ini masih dianggap sebagai aib oleh orang tuanya sendiri. Sehingga proses penyesuaian masih kerap dilakukan di usia bayi atau balita. Dan tidak jarang setelah dewasa atau di atas 18 tahun, mereka mencari tahu sendiri tentang identitas dan kondisi tubuhnya, di mana tidak sesuai dengan yang dipilih orang tuanya. Dan akhirnya setelah dewasa, mereka tidak menuntut secara hukum ke orang tuanya, tapi menyalahkan orang tua dan dokter yang melakukan operasi. Itu. Namun, hingga saat ini dari kami komunitas intersex sangat bersyukur karena per tahun ini ada komunitas intersex satu yang bertambah selain kolektif intersex, ada namanya Intersex ID, gitu. Dan aku juga mungkin berharap penelitian ini juga bisa membuka kebijakan hukum yang ada di Indonesia untuk mempermudah proses perubahan identitas di KTP maupun kebutuhan administrasi lainnya. Kenapa? Karena beberapa di antaranya ada kasus perubahan identitas di pengadilan yang ditolak oleh hakim dan ditolak dibenturkan oleh hukum agama, bukan undang-undang gitu. Namun kalau berdasarkan medis sangat mendukung proses penyesuaian identitas di ranah hukum. Karena di Indonesia bisa dibilang cukup mudah bila meminta dokter untuk menjadi saksi ahli di pengadilan. Hanya saja terkait penggunaan istilah kata intersex itu akan menjadi permasalahan bila kita berbicara dengan kedokteran. Karena kata intersex sejak tahun 2006 sudah tidak dipakai di kedokteran Indonesia. Nah, saat ini di Indonesia lebih banyak memakai istilah disorder of sex development atau difference of development atau hipospadia. No, hipospadia. Hipospadia. Hipos. Ya, oke. Itu yang memang banyak terjadi di Indonesia. Hanya saja aku sepakat dengan yang Nicole sampaikan tadi. Kerangka medis perlu penetapan. Bukan kerangka medis itu seolah-olah menjadi jalan keluar terakhir untuk membantu orang tersebut untuk disembuhkan. Gitu. Padahal ini adalah kondisi bawaan yang memang secara lahir sudah terbentuk seperti ini. Dengan alasan kembali lagi tadi disebut sebagai aib, sebagai hal-hal yang dianggap ya memalukan. Kurang lebih kayak gitu. Terima kasih.
Thank you so much, Tata, for highlighting these themes. I think it's very much relevant to our discussion, particularly the fact that you mentioned that in Indonesia's context, there are lots of decisions which are being made, which are being made from a religious perspective and not necessarily from a human rights perspective. I think this is one of the challenges that we have highlighted in our research reports, and one of the broad purposes of why we conducted the research, that decisions with regard to intersex rights, they need to be done from a human rights perspective. This is something which has been missing from the conversation till now, and we hope that your work and the research work that we are taking up, it contributes to creating this kind of consciousness within the lawmakers and policymakers. Tata, you have already provided a very solid ground with regard to solid overview with regard to the situation in Indonesia. I guess maybe I can turn to Edith now, who's been waiting very patiently. Edith, you are both an activist as well as an academic researcher, and I wanted you to perhaps reflect a little bit about your experience while conducting research and reading the academic literature on this subject, because I understand, the situation which Tata highlighted, that there's very little material available on intersex issues in Indonesia. So of course, you would have had to, refer to a lot of material, from around the world. So from that, I just wanted you to perhaps reflect on that particular point and how it was, related to the Indonesian context, or how it can be made more relevant to the Indonesian context.
Thank you so much, Prashan, for having me here, and also for all of us here. Happy Intersex Awareness Day. And yeah, I hope we keep continuing this resilience struggle, amongst the intersex folks that always been in the front of the work, and also us as the allies. Yeah. So for me, personally, when I try to reflect it on these different kinds of literatures, for me, like I felt a little bit overwhelmed because it was a lot. It was an extensive reading, and it means that it requires a language privilege in a way. So I want to also acknowledge that. That's why it is quite, even for me, with a person that already pursue a degree with also like not really good score in my MA degree, and try to go deeper into this extensive work, it is still a lot for me. So I think it is very important that the Intersex Asia try to translate this research. So that's one thing that I want to acknowledge in realizing my feeling on this research, especially navigating my space on understanding this different academic literatures. And I think I want to also say that what Tata has mentioned and other folks has mentioned also already put in the research as well in the global scenario. For example, like in 2018, there is a research around how to try to see the intersex equality in regard to the legislation process, because this is the one approach that can uphold the resilience of intersex people through law, because that's what we have been struggled about, how to challenge this medical construction of the that what has been said before, that intersex body and intersex life experience should be fixed or normalized through surgical intervention or other medical treatment. So I think for this one of the area, I can see there is like some of the state response toward this intersex people, intersex justice. So one is the non-responsive one. So in this regard, that state never want to distribute the power between medical and intersex individuals, and Indonesia is this non-responsive one, I should say it. And then the second one is the status-based approach, which very focused on recognizing intersex within the law, that I think has already mentioned by colleague from Thailand also, like how to integrate it into the anti-discrimination law or through the specific marker, gender-specific marker law. And the last is the holistic one. So it is really try to challenge the power imbalance between the medical institution and intersex individuals. So I think from this kind of these three different approach of state, it can also leads to, in this particular research on this, there was also a discussion that the researcher tried to ask to the intersex activists. I think it is based in Europe, I guess, yeah. But I think what Fox has already mentioned, that the intersex activists also acknowledge that this power imbalance between this medical profession and medical institution, with intersex as the agency, as the individual itself, is actually very embedded, structural, and systemic. So this is a thing that should be addressed, as the root causes in the holistic approach. And if it is not addressed, then it becomes a way that can lead to the intersex experience become a shameful things, like what some of folks already said about the shameful and shameful secrecy. So and it pertains the traumatic experiences in a daily basis for the intersex individuals. So this power imbalance is totally ruin everything into the intersex daily life. And I think also there was also an address about the conflation also between the trans and intersex issue. It is already acknowledged too, for example, like in such of the country like New Zealand that allows X on the passport for the so-called indeterminate or unspecified sex. Sometimes it's also conflict between which part, because it is not especially addressed the intersex term mentioned in that, and also the term of the third gender in Bangladesh. So maybe it's also part of the reflection of how this term as the umbrella term can also lead to another way on, for example, how to navigate the trans and intersex issues in a different sphere, and also the consequences into the social cultural aspect. And I also want to acknowledge the research from the Morgan Carpenter, so who are the intersex activists and researcher too, especially in helping me to understand this intersex variation and human rights, and also international classification of disease. So yeah, I think for me it is also important that the intersex activists and researcher, I think they also try to shift the pathologizing classification in the WHO codes, especially with the ICD. And I think that's why some of the recommendation is very clear, and I think very also echoed in the previous speaker, saying about the terminology. The terminology usage is so crucial, and addressing or in pathologizing this the intersex lives. So for example, that like WHO should reconsider about the introduction of the unnecessarily pathologizing language of disorder of sex development, like what Tata already mentioned, into the ICD. And also instead of using that, adopt another alternative language such as congenital variation of sex characteristics or different sex of development. So I think the message is clear in terms of the terms that proposed by the intersex activists and researcher in regard to the challenging this medical construction. Unfortunately, and also one thing that Morgan also addressed is about to add the new code for the intersex genital mutilation, because it could facilitate access to reparative treatments for the intersex person. But I think this incredible research still becomes a challenge when we try to implement it in Indonesia, especially when I try to see some literature from the even from the sexual adjustment team, one of the team that is already appointed by the government through the Ministerial of the Health to specifically do this adjustment for the intersex. They still use what Tata already mentioned about this disorder of the sex development, and also still use the term, like even the corrective intervention also still be used in those journals, those medical journals that they provided. And I guess also there are some of the maybe like Islamic scholar that try to also respond to that to this issue, especially with the Hunsa, and this scholar also tried to refer to the one of the religious edicts of the Indonesian Council Ulama. It is about the sex change and sex refinement. So it says that sex change is forbidden, but sex refinement is necessary, especially when it comes to the for the intersex person or for the HUMSA based on the recommendation of expert doctors, but still they always refer to the physical indication, not to the psychological aspect too. And I think that's why, like what Tata said, it is so easy for doctor to be the witness during the court when it comes to this process of the changing of the legal markers. The name and also the legal gender markers. But I figure out that there is like one journal written by Saskia Wirenga. So it is based on her experience working together with this hospital that is assigned to be the sexual adjustment team inside this hospital. And at the time she became one of the researcher to help another hospital in Netherlands. So they have like the collaboration between the hospital in Netherlands and the hospital in Central Java. And she tried to also criticize a lot about the usage of the term patient to refer to the intersex individuals, which when I tried to confirm to one of the intersex activists that he also challenged this terminology, like to keep saying intersex variation as the patient. So that's what the one critic, one of the finding from Saskia at that time. And even the team of the sexual adjustment team also clearly pathologized the intersex body by saying that they will make every effort to enable their patient to establish normal sexual relation. So it goes again to the idea of the penile-vaginal contact, to the idea that you can marry in the future, so you can have good family, you can have the good children, and they will be happy for you, and then your family won't get ashamed because of that. So this kind of the narrative still persists, I think, strongly in the research area, in the medical perspective, and also in the Islamic learning in the Sharia, in the Islamic Sharia law. So so with the question of how to integrate it, well, I see a big challenge, but also another opportunities. I think I agree with what Prashant have said about making sure that the human rights-based approach should be integrated into this layer of this institution that keep pathologizing intersex body. So I think this kind of extensive literatures can be addressed to some of the institutions, such as especially for the National Human Rights Institution, because they clearly have the term already, especially for the National Human Rights Institution in Indonesia, or the National Commission on Violence Against Women. They have the term saying that they, in their own manual on the human rights defenders, saying the intersex human rights defenders. So perhaps it could be a way to start the discussion, and because they have the mandate to raising awareness, and also to make the monitoring of the human rights violation in different institutions, including in the medical institutions. So I think it will be a good opportunity to start to discuss about this extensive research literature. To the perhaps to the other medical profession, or other colleague that also try to integrate the human rights-based perspective into their health sectors too. So I want to just stop
Certainly.
there.
Thank you. Thanks a lot, Edith. There's lots of important points over there, and I totally agree. Pathologization is something which has a huge consequence with regard to intersex rights, and it should be perhaps like the foremost agenda as well. 2019 was a huge missed opportunity for the WHO, and I hope that there is more resources which are made available to intersex organizations to actually advocate for depathologization. I also wanted to highlight one very specific thing that you said about the availability of material on intersex rights only being in English, which actually, restricts awareness raising work also, and it also increases the amount of work that intersex-led organizations within Asia, what they have to do, because first of all, they have to create the knowledge, and then also perhaps also they have they need to translate all the relevant material which is being created in English. So certainly that's one thing which we are very conscious of, and we try and do the translation work as much as we can. One thing which you mentioned about the conflation part, I think this is conflation in the minds of lawmakers. I think this is very commonly experienced across the Asian region. If I can give you the example of where I come from in South Asia, in India also, the law conflates trans and intersex people and puts them into one particular term in the law. And this is something I wish it was changing, but I guess this is still being followed. In the draft law, which was proposed in Bangladesh, the same conflation was being done. So I guess times are not really changing as such. But one thing I wanted to pick up on, which you perhaps touched upon towards the end, that is about engaging with specific stakeholders. And you named the national human rights institutions. I think that's certainly one of the important stakeholders that we could engage with. Naturally, they should be a natural ally of the intersex community, but I guess there is a lot of awareness related work and capacity building work which we need to do with NHRIs. And related to this, I wanted to throw this question to all the panelists. And we can go, whoever would like to go first. Which is perhaps the most important stakeholder that you consider, relevant for intersex rights? Because, this is a feedback for us also as an intersex-led organization who's doing advocacy and supporting advocacy work. Where should we focus our energy on? Which particular stakeholder you would like to target, in addition to NHRIs, maybe? Anyone, whoever would like to jump in. Nada, please go ahead.
Well, I would two key are multi-stakeholders that I like to engage the most. Okay, beside the government agencies, of course, we know who are the champions that can act as the focal points for us to propose, especially when the report launched, that we need to really working with them. Beside the government sectors, Ministry of Social Development and Human Securities, Ministry of Justice, as well as the National Human Rights Commission of Thailand. We would like to also engage with the leading CSOs in the countries, because in terms of size, in terms of budget, in terms of experience, long experience, more than decades that they had been working closely with, like, for example, the transgender community that is now has this huge progress working with Thai Health Foundation and reach out to the Medical Council of Thailand and the Committee on the National Healthcare Schemes, which is are in charge in terms of policies and development and implementation for sexual health care package for trans, and for gay, for example, that we really need to set up a meeting and show to summarize the key issues about that we've defining in the reports for them to also become our allies. I like to show them how okay, at least we share our cultural roots, and we also have some kind of distinguish in terms of gender identity and sex characteristics. But keep in mind that many intersex also identify as trans. We also sometimes the overlapping of demands still to be considered for them to ensure that the coverage of their program will be inclusions or inclusive enough. That's what we really think of. And so as the regional network, as they have the power to have the power of negotiations and to discuss with our embassies, located in each countries, where they have the budget for some kind of lunch meetings, some specific events like that. Like for example, like if a regional organization or CSO could discuss with some embassies who promote or pro LGBTIQ and plus rights, it would be very grateful for them to host the event for us to present the report, and also they have the power to also invite our government sectors, whether from at the state level or the local administrative level to be able to participate. It would be really helpful. We cannot wait for the federal or the central state government to take action. Sometime the local administrative also can have their own power and the regulation for them to create some kind of initiative project to protect intersex individuals, as they are the closest to the community on the ground. Yes.
Certainly. We should take a decentralized approach with regard to advocacy as well, and focus on the municipal level, urban and rural level governance bodies. Sticking with this theme before others jump in, I'm very conscious that I'm speaking to activists and authors based in Southeast Asia. Is there any regional mechanism also that you would like to highlight when it comes, that you see as a potential stakeholder with regard to advocacy on intersex rights? Or any other stakeholder, maybe not necessarily regional or sub-regional, from your country level perspective or anything sub-regional level? Jeff?
So I think we need to work now using intersectionality approach. Yeah, we need to work with the intersex community should starting to work to women's rights advocate, child rights advocate, sexual and reproductive rights advocate, because I think it's now time that we stand out together, because we need not only focus on the legal gender recognition, we need also to focus on the health. There are many intersex who are part of the indigenous community. There are intersex people who have old age. There are intersex people who have problem with health and different and through this, I think working with intersectionality approach, we will now have a bigger community that can help us in the lobbying of the policies that we need, that the intersex community needs.
Certainly. So Jeff didn't name anyone specific, but included everyone actually, I guess. So we have to work on all institutions possible. Very well taken, your point, Jeff, that yeah, certainly we need to approach this from an intersectional perspective and find all avenues possible wherever we can find an intersection with intersex rights. I have just little bit of time left before I open the floor for question. I wanted to take one more opportunity to ask everyone. As till now, we've been reflecting about the current situation and how things stand. I also wanted to ask you about how you look into the future as to what are the specific issues which are gaining prominence in your own national context that we all need to watch out for. That as a regional network, we need to watch out for, and the specific national level, initiative that you are taking up. So what are the issues that are gaining prominence in your context in terms of, in the near future? Whosoever would like to go first, please feel free.
Maybe very, very quickly. I
Sure,
think
Nicole.
a lot more research, I guess in general needs to be done centering the lived experiences of intersex persons in the Malaysian context for sure. I mean, all our contexts. But I think for me, I think one of the two things that are related is I think more research specifically on the lack of access to medical care for intersex persons. Like, I guess I know it's still on the medical aspects, but it's on the view, or I guess on the viewpoint from intersex persons, and how bad it is that they cannot access medical care, and as well as I guess the access point. Like, there are medical professionals, but it's so hard to find this information. and how that impacts their lives. And also related to this, also from a medical perspective, or is also kind of I guess, a non-medical research on how it impacts what the impacts of unnecessary medical surgeries and procedures or interventions on intersex infants and children. There are some that exist, like 1 or 2 studies here in Malaysia, like a pediatric study that shows that people who go through those interventions have a lower quality of life later on. But I think more of that is needed, especially that's from a lived experience point of view, so that it kind of brings it all together to show like, hey, it's not just the medical research that's saying this, it's also like different researchers are saying this, so that we can get to the point where we can get more, I guess, different stakeholders to start maybe putting out position statements, banning unnecessary medical procedures, or also just moving towards a step of just putting it into policies and practice of banning this practice. Yeah, I hope that makes sense. Yeah.
Oh, certainly. Access to medical services is a critical issue. One related thing that Intersex Asia is currently working on is a project on access to essential medicines. This is focused on Philippines, but hopefully we'll take this project at the regional level. We have a specific staff of person working on this particular topic. Any other responses with regard to future issues before I open the floor for more questions? Tata.
Ya, menanggapi, aku mungkin langsung 2 pertanyaan sebelumnya ya. Pertama, terkait dengan stakeholder apa sih yang bisa diajak kolaborasi? Karena kata intersex untuk dipakai di advokasi ke ranah pemerintah itu sangat sulit. Sehingga kita perlu menggunakan istilah kata hipospadiya atau DSD untuk melakukan langkah advokasi ke depannya. Tapi sejauh ini kita tidak bisa ke lembaga HAM di Indonesia karena lembaga HAM di Indonesia tidak memiliki kekuatan yang cukup. Kami sudah memetakan mengenai hal ini. Kalaupun mau melakukan langkah advokasi lebih lanjut, kita bisa ke Kementerian Kesehatan. Dan sejak tahun lalu juga kita sudah diajak untuk advokasi mengenai hak-hak orang intersex, mengenai obatnya, ya, perawatan atau yang dosa apapun yang memang di Indonesia tidak di-cover gitu oleh asuransi. Segala hal yang tindakan yang dilakukan pada intersex memang tidak di-cover oleh asuransi di Indonesia. Nah, oke, tambah lagi sedikit. Terkait dengan berita atau kondisi di Indonesia sendiri yang 2 tahun ini sedang pesta politik dalam arti pemilihan pemimpin negara dan daerah di Indonesia, isu LGBTIQ itu selalu diangkat dan diangkatnya dalam sisi negatif sehingga proses advokasi tetap tidak bisa memakai kata intersex. Gitu. Dan aku setuju dengan yang terkait kolaborasi dengan pembela hak lain dengan ragam isu lainnya. Hanya saja yang perlu dicatat apa untuk masuk ke sana cukup punya tantangan. Ditambah lagi stigma tentang intersex di Indonesia sudah cukup melekat gitu, dan proses edukasinya pun aku rasa cukup butuh waktu yang panjang.
Thank you. Thanks a lot, Tata. I'm afraid we have very little time left, so maybe I'll just ask people to, whosoever would like to ask a question, please feel free to unmute yourself and say your name and the specific person also who you would like to, answer your particular question. So I see Selvan's hand up directly. Selvan, please go ahead.
So, hi, my name is Selvan Anthony. Thanks, Prashant. It's a very wonderful discussion about intersex and related matters. I'm so glad that I'm here. So, I just want to introduce myself. My name is Selvan Anthony, working in Intersex Asia. Recently joined in Intersex Asia as a programs manager. This question is not directed to anyone. Maybe anyone feel comfortable, please feel free to answer. Sorry, my voice is gone. I just want to ask about the social media platform because these days social media platform plays a very important role in terms of raising awareness, advocacy, etc., etc. So much important. But I'm really afraid to see in some countries this is not the same case. So I really want to understand from you what do you actually or how do you actually think social media platform has for the intersex community in terms of its risk and opportunities, particularly within the context of some conservative countries, for example, Indonesia, for example, Malaysia. That is my question. So maybe if you feel comfortable to answer this, please go ahead. Thanks, Prashant. Over to you.
Very relevant question. Both there's a lot of potential in using social media for advocacy and awareness, and then also the risk of security, digital harm. Jeff?
Yeah, I believe like social media plays a vital role, especially in advocating for intersex right, for awareness and visibility campaign. But there's two sides of it. It's very positive that we share positive awareness about intersex issues and challenges, but also in the context of the Philippines, where media always telling the people or the public that intersex has two fully functional organ, which is a misconception. They all like all of the hard works that is being done by Intersex Philippines is being like in a glimpse of in the glimpse of an eye, we're all been wasted because of media representation of all intersex. So yeah, there's really two sides of it. That's why we should also like sensitize media practitioner on how to tell or portray intersex people and share their stories. Thank you.
Thanks a lot, Jeff. Nada, you also wanted to go ahead with this?
Yeah, as an intersectional identity persons, I used to launch media campaign with many social medias, the famous social medias are agencies, like the feedback quite remarkable at some points, like for example, when I launched a short documentary videos, I reached 1.8 million views. Almost every comments are very generous and kind and embrace, to understand about the livelihood, the difficulty and challenge obstacle that intersex people might face. But in the same time, when it's come to our official page, like Intersex Thailand, when we announced the campaign to talking about the complexities of our sex characteristics, are the chromosomal issues that related to our internal sex organ, outer sex organ, something like that. Then suddenly, the medical professions, our sex educators, like came along and splash all their interphobia statements against us right away. I was entirely shocked that how come it's happened almost in the same period of time, and especially during the a typical event, as we all know about the Paris Olympic Games, the situation that happened with two female boxers are, like from Taiwan and from I'm not sure what country. Her name is Imani Khalif. It also show that, oh my God, interphobia is extremely really hard. They keep coming to attack us on our social medias, like day by days. And even we have allies, like our transgenders, like all community members who try to raise awareness with understanding about what intersex means. And then it's sadly that one of the lecturer from my university, which not from the law school, from the other school, and we also launched the Mafalung University Pride event, and the Vice President also came to give the opening ceremony and remarks. And you see that when it's come to individual level, those might use their privilege power, like being lecturer, I know how privileged and the source of power we have in our hands to report the crime. So it's kind of another slap case against her right now, which is still complexity, which I have to really, like figure it out. And because the belief on the conventional medical scientific knowledge based on male equal XY, female equals XX is still very solid, deeply rooted at the core of the earth, something like that. So our work is, like when we had our first team building turn back in just last August, the first common ground that we will keep working on very hard is to eliminate all form of interphobia against our innate sex characteristics. That's why our campaign in the future will be launched as Intersex Universe. So we aim to provide people to understand that our being the sex is beyond, and it's not just happenings nowadays, and we try hard, and we're working closely like with ally, especially the medical doctor who are truly understand the sensitivity of like being born as with the diverse innate sex characteristic to end interphobia. That's what we really, and talking about the point, as also I am also Muslim. And when we launched the campaign like a couple of years ago about being intersex and trans in Muslim community, you can't imagine how, like I received a death threat. Someone sent the pictures of the swords. Someone sent the picture of the gun. Someone sent statement about, would you like to meet your Lord earlier? Something like that. So it's kind of like mentally impact me, and everyone knows that you will notice when you read my research that I noted that is the difficulties, that the mental impact that I have been faced because of trying to launch the campaign is still here, like even it's under control, but it's still here. And when we asking for justice for this, who are responsible for our pain, our scar that lives in our heart? That's the question. Go back to the public in general. Yes.
Thanks a lot, Nada. It is really concerning to know the kind of threats which people can receive because of their activism, the kind of positive awareness work that they are doing, and we're glad that we have braved through all that and faced so much backlash and still continuing. More power to you and your organization. Jeff, did you want to
Yeah.
come in?
Yeah, I
Sure.
forgot to mention that. Yeah, I forgot to mention that although social media, especially social media, is like has a lot of negative things to say about intersex people. Uh, social media it's a powerful tool where we also get our members, because on the social media, people says that, and picture lives of intersex people. They say that, oh, my friend is same as that, my relative is same as that. So yeah, even though it's negative, that the news is negative, the story is negative, it's also like a win-win for us, because we have reached out to other intersex people, because they show it, it shows in the comment section. Thank you, thank you.
Thanks a lot, Jeff. It's certainly a very important tool for community organizing. However, if only we had some systems in place with regard to, protecting the community as well while, we are doing this kind of advocacy work, I think that would be great. It's something for lawmakers to look at. I'm afraid that we have completely run out of time. So I would just like to conclude. I cannot possibly summarize the amazing discussion and the length and the breadth of discussion that we have had today. But I guess one very critical point that I would, like to emphasize towards the end is, you would have noticed that almost all researchers, highlighted this point of participatory way of, approaching research, and that's something we've tried to do, at Intersex Asia in our research initiative. At every step of the way, the intersex community was very closely involved, either as a researcher themselves or as a key informant, or during the community consultation stage. So that's something, something to take away from. I see there are several researchers and academics also who are attending this particular webinar. This is a very important takeaway. Also, I guess you would have noticed the importance of continuing the awareness raising work. What Nada highlighted as, that this stigma has reached the core of the earth. I guess that's truly reflects the seriousness of the issue and how much awareness work is really needed to bring it out and address the stigma. I guess I should also mention one more point with regard to the importance of having more material in Asian languages. You would have heard it from our researchers and panelists that all the research reports that we are launching today, they have been translated into Asian languages, and we'll be uploading the same on our website. You're welcome to browse the same. With this, I guess I'll have to conclude the webinar. I would really like to thank everyone who have taken out time on a Friday evening to attend this webinar. It's a very important day for us, a huge milestone for our organization. Now we have published 12 country reports, which give you a perspective of intersex rights in Asian countries. I would also particularly like to thank all our team who have supported us, in gearing up for this webinar. And one more particular shout out to Bryant, who supported us with the interpretation work. Thank you so much, Brian, for all your work. With this, I guess we are coming to an end. I thank you all once again.
Prashant.
Maybe, yes, certainly, Estelle, when I was about to get to the picture
Yeah.
part.
Yeah.
So since you all have taken out time, I guess as for all important occasions, we should take picture. I would encourage all the participants, if they are comfortable to turn on their camera, maybe it'll be great to take a picture with all of us together. Hello, hello. Wow, good to see. All right. So yeah, I can take the picture now. Okay, more people are joining in. Everyone is keen on being part of the picture. Wonderful. Yes. All right. Thank you so much, everyone. Have a great evening.
Thank you. Thanks, Prashant. Thanks, everyone.
Thank
Bye.
you.
Thanks a lot. Bye-bye.
You.